Hi, everyone. Good evening. Thank you for joining us today for our community conversation. My name is Tuma Kuriyan, and I'll be the moderator for the evening. So I'm just going to go over a few introductions and introduce you to our community conversations. I'm a clinical psychologist at UR Medicine, Pediatric Behavioral Health and Wellness. And I wanted to welcome everyone to today's community conversations, which are sponsored by the Greater Rochester Health Foundation and the Department of Psychiatry at U of R. I wanted to let you know that ASL live interpretation and Spanish language live interpretation is available. And you'll be able to see a little globe button at the bottom of your screen if you'd like to use those. You're welcome to use the Q&A feature in the Zoom panel to ask questions. You can ask questions at any time, and I'll be moderating the questions and passing on as many as possible to our panel. And we'll be answering questions that you submitted during registration through our presentation and panel conversation as well. But when you see a question that you like through the Q&A feature, you can upvote it by clicking the thumbs up sign. And although we can't answer every question live, we'll send out a resource email to all registrants, including a YouTube link and slides to the presentation. So lastly, I'll be polling the audience from time to time, as it's a nice way of sharing what we're thinking and feeling. Polls remain open just for a short period of time, so please answer and we'll share the results as we go along, and all polls are anonymous. So let's try our first poll. So if the first poll is, if you're a parent or parent figure, what age range does your child fit into? And you can check all that apply. So elementary, middle, high school, young adult, or multiple age ranges. So take a moment and click the ones that apply to you. I'll give people a few minutes. Okay, so I'm going to end our poll. I see that we have elementary school. A lot of folks have elementary school kids. We have middle school, high school. So we actually have multiple age ranges today represented for the folks in our audience. So I'm going to end that poll and you'll get to see the results on your screen. So we have quite a wide range today. So today's conversation is going to be about what to expect when looking for and getting behavioral health services for your children. And in order to get us started on that topic, here's another poll that I have. If you have a question or concern about your child's mental, emotional, or behavioral health, who would you go to first in order to seek help for your child? And please just select the first person, so just one person that you would go for. Would you first ask your school staff, doctor, your religious institution, a therapist or a counselor, family, or friends? Okay, as people are putting in their responses, we see a few folks. We have a few folks who will go to a number of different places. So some people say they'll start off with asking their doctor first if they had a concern. Some people school staff, some people would go right to a therapist or a counselor, and some folks will go to family. So as you see, people choose their first point of contact might be different depending on who's in your social network and who you're comfortable with. I'll give a few more minutes for a few more seconds for people to respond if you wish. Okay, so it looks like we have a bunch of people who would go to their doctor first. And we have folks who will go to their therapist, family, and friends. So we have a number of different ones. And then the second question was, how comfortable are you with starting the process to help your child receive mental health services? And we see several people feel very comfortable about that. And we have folks who feel not so comfortable. Hopefully by the end of this, you'll have some resources so that will help you feel more comfortable in that. Okay, so now I'm going to stop sharing my screen. So now I'm going to introduce our panelists. So I'm going to ask all the panelists to turn on their video so you can see them as I do the introductions. All right, so we have a great set of panelists today. Um, we have Dr. Fabienne Bain, who was a clinical psychologist at URMC for several years, and she's currently sharing her talent with Judge Baker Children's Center in Boston, Massachusetts, as an associate director. Dr. Bain is a strong parent advocate and, among many other talents, specializes in assessment, including assessment for autism spectrum disorders. Next, we have Bree Daniels. She's a licensed mental health counselor at URMC. Ms. Daniels spends some time at our school satellite clinic in Wheatland Chi-Li, and she's an active member on our racial justice groups and is leading a collaboration with the Urban Suburban program. Bree is also a Rochester native with strong ties to the community, and she incorporates narrative therapy and CBT techniques into her session with a focus on building better communication skills between children and parents. Next, we have Mr. Jason McDonald, and he's the parent of a teenager and very active community member in Rochester, New York. He's been a member of the Community Advisory Board for Pediatric Behavioral Health and Wellness at URMC, along with the advisory board with our partnership with the National Parent Leadership Institute and Pediatric Behavioral Health and Wellness. And he was an employee at URMC for several years and is now sharing his wonderful talents with the Villa of Hope. So thank you for joining us today. And lastly, we have Dr. Linda Alpert-Gillis, who is the director of UR Medicine, Pediatric Behavioral Health and Wellness Outpatient Services. She's been a faculty member for 33 years, and over the course of her leadership, she's grown this service from a small teaching clinic, which provided about 3,000 patient visits annually, to a large 10-location service, seeing almost 50,000 patient visits annually. So she's a mother to 3 and a very strong family advocate. So without further ado, Linda is going to be starting off today with a wonderful presentation. So Linda, if you want to get yourself situated by sharing your screen, and we'll say see you later in a few minutes to the other panelists.
Thank you, Tuma. That was very helpful. It's my pleasure to be here with you late this afternoon, and thank you so much for joining us. And thanks to our wonderful panelists that you'll be hearing from after my brief presentation. So let's just get started. So what do we mean by behavioral health or mental health? Kids and all people really have ups and downs in their life in many respects. So we all have periods of sadness, irritability, anxiety. So it's really about how we feel. It's also about our relationships with others. How are things going in our relationships with our family members or with our peers? Mental health is also about how we think about things. Do we engage a lot in negative thinking in terms of, you know, oh, nothing good is going to happen. Things are just going to be terrible. No one's going to like me at school. Or do we have certain thoughts that get stuck in our heads and that people dwell on over and over again? People even have thoughts of self-harm and thinking that there's no way to make things better. And questions about who they are and questions about their sexuality or gender identity. And also mental health deals with how people act, you know, difficulty completing tasks, or being impulsive, difficulty paying attention, difficulty expressing their behaviors and feelings appropriately. And a lot of things are affected by life events. And many people have stressful life events in their lives that influence all these things, or traumatic events, and have big changes in how they usually function. So if you have concern about your child, how your child is doing in terms of their overall behavioral health, one good way to get started is by getting input from others. And so that may mean your primary care doctor or nurse practitioner, your school, friends and family, are also getting information from websites, religious organizations, or hotlines. So I'm going to talk a little bit more about that briefly. So pediatrics is all about health, and behavioral health is certainly part of that. So it's important to know that pediatricians, family medicine physicians, nurse practitioners, all have a lot of knowledge about behavioral health difficulties in children and teens. And that research has shown that if an issue is brought to them, they're very accurate in determining what the problem is. And so you may notice that when you bring your child to a primary care visit, they'll be given questionnaires about how they're thinking and feeling. And that's because pediatricians and family medicine doctors feel like that is part of what they do. And so they want to screen and catch those difficulties early on. And they'll often ask you and your child about how they're doing emotionally, behaviorally, and socially. Do they have friends? Are they enjoying activities? So it's important to remember behavioral health is health. It's one of my favorite sayings. And oftentimes, medical professionals will give you recommendations on how to address your concerns. For example, a lot of behavioral difficulties may stem from kids not getting a good night's sleep. And so they may have some great recommendations on how you can help your child get a better night's sleep. They'll also are very familiar with how to access other resources that may be helpful to you or your child. And in some cases, prescribe appropriate medications, for example, for kids with attention deficit disorder, depression, or anxiety. So pediatricians are trained, and we actually provide additional training to pediatricians throughout New York State on when and how to prescribe medications for children. Schools are another important source to go to. And it's not just the school mental health staff, which are wonderful, but also teachers and administrators. And oftentimes you may notice that schools also screen for mental health difficulties, because the sooner those are identified, the easier they are to treat. And schools can provide counseling support. They can address academic and social issues that contribute to mental health concerns. They can make classroom-based changes if a child is experiencing bullying in their classroom or difficulty paying attention. They could move their seating location. They might move the class that they're in. Schools are very knowledgeable about community resources. We also do a lot of training for schools on what community resources are out there. And some schools also have embedded mental health clinics, and we have embedded mental health clinics in 4 school districts currently. So when to seek behavioral health care. So the first thing to think about is the severity of the problem. And usually I like to describe that as, are the concerns interfering with daily life? So is your child anxious in a way that prevents them from going out and having fun, prevents them from attending school? So are they interfering with day-to-day life? Another thing to think about is how long it's been going on. So if a child doesn't want to go to school for one day, maybe they have a test that they're worried about, or they're concerned about school picture day or something like that. That's one thing. But if a child hasn't gone to school for a few days or for a week, then that's something to be more concerned about. And is the problem resistant to change? So have you discussed it with your pediatrician and you've tried all the suggestions that they've had, or you've talked to the school and you've tried their suggestions and things are not getting better, or maybe even getting worse? Then those are times when you might want to seek out specialized healthcare, behavioral health care. So I'm going to start with crisis, what to do if you're experiencing an emotional or mental health crisis with your child. And then I'm going to talk about outpatient care. So we have 2 great emergency departments in Rochester. We're very fortunate. In the surrounding counties, we also have excellent emergency departments. So U of R has a CPEP, which is a comprehensive psychiatric emergency program, and it's licensed that way with the state. So we provide a lot of services within that CPEP organization. And then Rochester Regional also has an emergency department, and that includes a psychiatric emergency department. So when should you use an emergency department? That's a question that we often get asked. So if you have an immediate concern that your child may hurt themselves or someone else, that is when you should go to an emergency department. And the way you access that is to either go there with your child or to call 911 and let them know your child is having a mental health emergency, and they will help you get there. And what happens when you go to an emergency department? Well, the first thing they always do is screen for physical health concerns, because as you know, some behavioral mental health concerns are brought upon by medications, by alcohol, by substances. And so the first thing they want to do is make sure that your child is physically healthy. And then they will look at the child's mental health concerns. And basically they're deciding whether or not your child requires hospitalization. That's the main goal of going to an emergency department. So it's important to know what to expect and what you're likely to get from going to an emergency department. Another thing you can do if your child's in crisis is to contact the mobile crisis team. And Monroe County has a mobile crisis team, and some other surrounding counties do as well. So what that means in Monroe County is that two staff clinicians will go to the child's home, school, or Walmart parking lot, anywhere in the community to meet a family and provide services. So when should you use mobile crisis? If there's an urgent concern that's not life-threatening and requires a really quick response within hours, to access it, you call 211 on your phone, and that connects you to Lifeline, and they will connect you and help you with mobile crisis. So what happens? So as I said before, they gather some information over the phone. They figure out when and where they're going to meet the child and family, and two clinicians come out and assess your child's needs and help link them to services. They're also evaluating for whether a child needs to be in the hospital, but it's a much more relaxed situation because the child is being seen in their home environment and not sitting and waiting for long periods of time in an emergency department. So we highly recommend thinking about it. Also, sometimes people ask, they don't want their neighbors to know. So CPEP, when the staff come out, they come out in unmarked cars. So they just come out, they're dressed in regular clothing, and they ring the bell and knock on the door. So there's a lot of privacy in that. And another thing you can do if a child's in crisis is you can access our crisis intervention services at UR Medicine Pediatric Behavioral Health and Wellness. So when would you do that? When a concern has come up quickly that's interfering with typical functioning, kind of like this example I gave of the child not going to school for a week. So there's not an emergency happening that you would want to go to the ED for, but you do need to get help pretty quickly to figure out what's going on. So that is for something that comes up quickly that is interfering with functioning, and it's for children that are not already involved with a mental health professional already. The way you can access that is you can call the Behavioral Health Crisis Line at 275-8686, and a family or primary care provider can call. And what happens is you get scheduled for a session, a brief solution-focused treatment, which is an evidence-based treatment, which has been shown to work. And kids and families can be seen for 1 to 6 sessions, and then they are linked to other resources if necessary. Okay, so what are the other quick access options? Well, we're very fortunate that we have 2 organizations in Rochester that provide walk-in services. So you can just walk in at the dedicated time and see a mental health professional. So Rochester Regional Health has one at Genesee Mental Health Clinic. And they see kids ages 5 through adult. And they have just reopened their walk-in hours, and they're Monday, Wednesday, and Friday, 8:30 to 10:30. And they also have virtual walk-in hours by Zoom, and you call the number and they set you up for a Zoom call that day. Catholic Family Center also has Zoom or walk-in calls, walk-in hours for all ages, where Genesee Mental Health is right now just doing that for youth. And there's also some national helplines that you'll get on our resource pages that we'll send out to everyone who registers, of a parent helpline, a national suicide hotline, and a crisis text line if you prefer to text, or if your son or daughter prefers to text. So now I'm going to talk a little bit about outpatient services. So a lot of how you decide on where you're going to go is based on location, close to your home, what kind of services they offer, how much it's going to cost, is it a place that your insurance will refer to, and recommendations from friends, family, and other providers. If you need more information about any mental health service, you can call Lifeline, #1 place to call, or your local office of mental health. So I'm going to talk a little bit more about Monroe County, where we are right now, but every county in New York has an office of mental health, and they will help you get connected to services. So we're lucky to have a number of different agencies that operate within Monroe County. As I mentioned before, Genesee Mental Health Clinic of Rochester Regional Health, Liberty Resources, the Villa of Hope, Catholic Family Services. There's a number of private practice clinicians in the community, and U of R Pediatric Behavioral Health and Wellness, which is where I'm from. So I'll tell you a little bit more about our service. We see kids from birth. So we're the only regional place where people with preschoolers or toddlers that are having behavioral and mental health challenges can call. So we see kids from birth. We're a regional service, and we serve the 9-county area around Monroe County. And we provide services both in person and telehealth. We have 2 main locations, a new building at South Ave, and also a location on East River Road. In addition to that, we have 3 primary care locations, 4 school-based locations, and a satellite at the Mount Hope Family Center. Our values are very important because they drive the kind of care that we provide. So we're very patient-centered, and that we think each child is unique. We're family-driven in that families call the shots, and families tell us what they're looking for and what they want to work on, what their goals are. We're family-oriented in that we think about the family as a whole, and we want the whole family to do well. We focus on strengths and building strengths rather than focusing on weaknesses. We try to be culturally sensitive at all times, and we try to be, and we are, developmentally appropriate. So a 2-year-old is going to have a very different experience with us than a 17-year-old, needless to say. We're fortunate to have a racially and ethnically diverse healthcare team, which I am so proud of. We have a number of bilingual Spanish-speaking clinicians, and for other languages, we have interpreter services for all languages, including ASL, which you're seeing today. And we have a very strong family advisory board because we feel that parents can help us develop the best services for the families in our community. So how do families get started? Well, the first thing that happens is families call our main number, 279-7800. And if they're in crisis, they're immediately given a crisis appointment in our crisis intervention services. That's it, one stop. If a family is not in crisis, then we schedule a very brief phone screen. And then we review all those phone screens with our intake team. And 3 different things can happen. One is that the family is matched with a clinician that will meet their needs. So as you've heard today, everybody has specialties. So we want to pair a child who's 2 with someone who works with young children and deals and is expert deals with it in an expert way, the kind of challenges that they may be experiencing. If a child comes up to us with LGBTQ issues, we want to have a clinician that specializes in that can really address that family's needs. So it's about matching with an appropriate clinician. We spend a lot of time on that. The second option is that we put families on a wait list, which we hate to do, but happens because we can't possibly meet all the needs of all the families that reach out to us. And we always provide other options that if families do not want to wait for services, that they can access other options. And the third thing that can happen is we refer to other services. And this is generally when we feel that another service would be a better fit for whatever reason. Maybe it's a family that's contacted us from the Thousand Islands, and we know that there is a service that can provide for that family that's only an hour away from their home versus driving all the way to Rochester. I should also say that our Family Advisory Board also developed a list of resources that all families get sent out to them, regardless of what category they fall into. So now I want to speak a little bit about what you can expect from a diagnostic evaluation. So the first thing you can expect is lots and lots of questions. And that's because families are the experts on their child. So lots of questions to the parents and caregivers and lots of questions to the children as well. And that's to be able to help us figure out what are the things that are influencing the fact that the child is having a problem and to better understand what that problem is. So we look at lots of internal factors, which are factors that are internal to the child. So were they a cranky kid? Are they an easygoing kid? How do they feel about themselves? What kind of skills do they have to cope with things? And we look at external factors, things outside the child, things about what's happening in the family. How are things going with their peers? Are they being successful at school? Have they experienced some significant life stressors? And because we know that all those internal factors and those external factors affect children's health, their physical health, emotional health, their academic functioning, and how they do in their relationships. At the University of Rochester, we do 3-session evaluations. And the reasons why we do that is we dedicate 2 full sessions to information gathering. That's where all those questions come in. And the 3rd session is really providing feedback to the child and family about what we think is going on and what would be helpful to make things better. Other places do it in 1 session. Other places might do it in 2 sessions. But at the University of Rochester, we use a 3-session model. So what are the outcomes of a diagnostic evaluation? Basically, 2 outcomes: a better understanding of the concerns for the family and recommendations on how to make things better. So when we discuss with families their concerns and answer their questions about why this may be happening, we do provide a diagnosis. And a diagnosis is helpful because a diagnosis helps summarize what the primary nature of the concerns are and helps us know which treatments are going to be most effective for your child. So diagnoses, although not perfect, are helpful in guiding the kind of treatment that has proven scientifically to be effective. A diagnosis is also required by every insurance company because they want to know that they're paying for treatment of an identified health concern. And so that is something that we don't have an option to skip. The second outcome is to provide recommendations on how to make things better. And so we pride ourselves on providing evidence-based psychotherapy. That is therapy that has been shown scientifically to be effective for a given problem. We provide individual therapy with family involvement, group therapy with family involvement, in family therapy. And you can see the common word in all those is family. It's a family deal. And medication consultation and management, which is done with parent input. And we are not quick to medicate. And Laura Cardello will be doing a presentation in early December on that very topic. We may make other recommendations, such as school consultation, connection to other resources, or additional evaluations. So what can you expect from therapy? The most common type of therapy we provide is individual therapy with parent and family involvement, but we will recommend group if that's indicated, and we do take a strength-based approach. And that should be true of therapy regardless of where you receive therapy from. We usually see people every 1 to 3 weeks, and usually appointments are more frequent when we start, because it's important to get a good start when you're addressing an issue. And you'll see progress over time. So lots of times families want to see progress after one session, but that tends not to be how it works. It sometimes works that way. So things get better quickly sometimes, and sometimes it takes longer. And sometimes things can even get worse when you're first identifying a problem. All services have to have 24-hour access for crises. And so we have a behavioral health crisis line. Other places that you may go for treatment also have 24-hour access to a crisis line. And often we are asked, how long is my child going to be in treatment? So the length of treatment varies, as I said, and just like how quickly kids get better. So usually we see children and families for 3 to 9 months. That's most typical. Some are seen longer, some are seen shorter. The goal is always that we provide treatment in the shortest time possible, so families can use their precious time and resources for other pursuits, like extracurricular activities, sports, and other fun things that you want to do. So my last closing remarks that I want to share is that parents and caregivers need to take care of themselves. Just like they say on a plane, you always want to put on your oxygen mask first before helping those around you. You have to take care of yourself as a parent. Parenting can be mighty stressful. So you want to make sure you're taking care of your own needs, seek out support from others, figure out what helps you cope, find joy in the special things about your child, and celebrate their strengths and achievements. So on that note, I will turn it back to Dr. Kuriyan, who will begin the panel.
Thank you so much, Linda. Really appreciated that very expansive overview of the services. And now I'm going to turn it over to our panelists. So our first panelist is Jason McDonald, and he's going to be sharing some tips with you. Hi, Jason.
Hi, good evening. Glad to be here. So my tips would be that when you get services for your child or you're preparing for service for your child, be prepared to be involved. Be an active parent. Get the diagnoses, learn, understand the diagnoses, work with your therapist and be open-minded with them and their tips on helping your child with the issues that they're facing. When at home, in between your therapy sessions, reiterate what you're learning and what the child's been learning at therapy. It's very helpful to remind them, especially in the hard times, hey, remember at therapy we did this, or maybe not even mentioning therapy, just doing it naturally so that it becomes a natural flow to their life. As well as see if there's group therapy available for your child. Group therapy is actually therapy. Sometimes it helps our young ones to see other ones that have maybe some of the same issues or some of the same things they're dealing with and work together as a team. Team building sometimes also helps. So look into group therapy as an option. And like Dr. Linda Alpert-Gillis said, self-care. I'm a strong believer in self-care for our parents. In order to take care of someone, you have to be healthy. You need to be in a good mind and a good place as well. In the new world that we're living in, try to find a way to have some self-care for yourself. We always say, even if it's reading a book, if it's getting out, walking your dog in the morning, get some time for you so you can regroup and be the best parent that you can be. Thank you all very much, and I hope you have a great evening.
Thank you so much, Jason. I appreciated that. Our next panelist is going to be Dr. Bain. If you want to turn on your microphone and video and join us, we'd love to hear your tips.
Yes, thank you, Tuma. And so when a family has to go through an evaluation process, it's normal for them to have different types of feelings. So they might feel anxious, they might feel excited due to the long wait list. Your child might feel anxious as well, and all of them are normal. And so I think it's important just to remind families that this is an opportunity for parents to work collaboratively with a provider to try to meet the need of a child. And so some of the things that can be helpful when starting that process is to be prepared. So if there's any documentations from previous evaluations, school documentations, documentations from medical evaluation that are handy, it can be helpful to bring those forms to the evaluation process to make it go smoother. And make sure that the provider also have a comprehensive image or idea of what's going on for your child. So being able to share those information can be helpful. Also having all the caregivers involved, being part of the evaluation is also important. It's very common for parents to see things from a different perspective. So having a mom or a dad who see things from a different point of view. And so we want to include both of them. And so having both parents be involved, particularly with everything being remote. So it can be a phone call or it can be joining in a Zoom, the Zoom call from remotely can be very beneficial. As Dr. Alpert-Gillis has mentioned, the process has several different steps. One of them is the feedback session where there's going to be some recommendations. Again, remembering that the family, as Dr. Alpert-Gillis has mentioned, is the expert. And so if there's any questions, concerns, if you have any anxiety or worries about the process, as mentioned earlier, it's important to feel comfortable sharing those information to the provider to make sure that they really meet the need of the family and your child, and that again, it becomes a collaborative process. And due to our time now, a lot of those evaluations are happening remotely. And so I know a lot of family may have some anxiety about that remote assessment. So, but it is successful, and if anything, it can be very flexible. So it is possible to have a very good evaluation done remotely via Zoom.
Thank you, Fab, for that. Now I'm going to move on to Bree, who's going to provide her tips as well.
Absolutely echoing what my colleagues have said, the most important thing for parents who are engaging in the therapeutic process with their child is to have compassion for yourself and for your child. We all like to operate out of the idea that kiddos and families are doing the best that they can. And it's important to remember that during times of distress. If your kiddo's having a really tough time, it's okay to be gentle with yourself and remind yourself it's a tough time, it's a tough day, it's not a tough life. One of the other things that's incredibly important when entering into the therapeutic process is communication and feedback with your therapist. Our goal as therapists are to make sure that we're not only working with the client, but with their family. Part of our goal at Behavioral Health UR Medicine is to make sure that parents feel like they are engaged with the process. We want all of our families to have open communications with whoever it is that they're working with. And that comes down to the very basic idea of building rapport with families and with kiddos. How do we expect kids to trust us if we don't give a little bit more of ourselves to them? And another huge idea of self-care that Jason mentioned and Dr. Alpert-Gillis and Dr. Bain mentioned is utilizing the community resources we have, whether that is a parent support group, whether that is finding your own therapeutic services, meeting up with friends, talking with different parents to see how their kids are doing. Because at the end of the day, we're all trying to get through this together, and we want to make sure that we're approaching it from a community standpoint instead of everyone feeling like they're alone.
Thank you so much, Bree. Well said. And now I'm going to invite all of our panelists to turn your video back on so that we can start answering some questions. We've had a number of questions that were already provided during the registration process. And then we are also taking questions live if you have them. So we do have one question that came in live, and that is about when parents disagree amongst each other about the severity of a child's needs or challenges. So what happens if two parents who are bringing in a child may not necessarily agree about the severity? So Bree, I see you nodding. I'm wondering if you wanted to start by answering that.
Yeah, absolutely. So again, wrapping back to the whole communication idea, therapy can be scary for parents and kids. We have to make sure that we are being incredibly sensitive when we are having these conversations. And so when parents come in and they're not necessarily on the same page, our focus has to go to identifying what are the general goals of therapy, what each parent feels like is really important, and what are some of the things that maybe each parent is willing to let go. So we talk about big button issues and little button issues in therapy. And so that's one of those things where when you're starting the process, it's nice to have a list that you can bring to your therapist and let them know, here are my big concerns. So we can work with the family and figure out where the needs are within the family, instead of having to kind of compartmentalize and divvy up, well, we'll work on mom's concern this week and dad's next week.
Sure, Linda or Fab, did you have anything else to add to that?
Yeah, and just to add to what Marie has mentioned, which I think is a good explanation of how to go about some of those situations, but ultimately, I think most families or parents, even though they disagree or may disagree about the severity or the situation, they do usually agree with what they want to get out of therapy, which is really for their child to strive. And so, as a therapist, the good thing is that a lot of the time, depending on the severity, their strategies are the same. Even and so really working collaboratively with the family about the solution, not so much about who is right in terms of defining the problem, tends to be the most successful. So yeah.
Thank you. Yes, you can often find a lot of common ground after you really talk about the situation a little bit more. So that was an excellent point from both of you. We're receiving a few other questions as well. So what happens if somebody is initiating the process of trying to get services for their child and they haven't really heard back from the clinic yet? What can they do to get more information about where they are in the process? Linda, I'm going to ask you to take that one.
Sure. And I answered a similar question in the chat as well. So usually if your child is not in crisis and you're looking for regular outpatient mental health evaluation and treatment, each phone screen gets reviewed by the intake team within 5 days, sometimes quicker than that. And then families are either called or a letter is sent out. If for some reason you don't hear back in that length of time, then you can call and ask to be connected to someone on the intake team. And then they can let you know where we are at in the process. Sometimes there's a little bit of a delay because I have to admit that I don't like to say no to families, and we get many more requests for services than we can provide in a timely way. So we do have an occasion where I think I will have the right clinician for someone. And so I wait for a few days to see if that clinician can see that child rather than having to put them on a wait list or refer them elsewhere. So if that's the case, then that's kind of like good news. And so, sometimes I do wait those few extra days to see if I can make it happen.
Great, thank you. Another question that came up, which also might be related generally, is how do we talk to parents? Do we ever talk to parents separately, not in front of the child? Do you kind of mix it where sometimes you're talking to the parents, sometimes you're talking to everybody? So Bree, did you want to take that one?
Yeah, absolutely. So as with everything in therapy, it's very dependent on the case. So we always offer parent-only sessions to parents so that they can feel involved in the situation. And so they can provide any information to us that they may not be comfortable sharing in front of the child. It's also important for us to remember that we stay pretty transparent with our kiddos. So as much as we will have these conversations with parents, it's also really important for us to share any relevant information with the kids. So sometimes we will have all of, parents and kiddos in the room together. So we can have those conversations that way, but we do offer parent-only sessions if parents are feeling like there's some things that they want to talk with their therapist about, and they don't necessarily want the kid there.
Great. Did you, Linda or Fab, did you have anything else to add to that one? Okay, I'm going to go to the next one, which is a great question. Oh, and I also wanted to mention Mr. McDonald, who was our parent representative, unfortunately had to leave a little bit early. So that's why you are not hearing from him right now. But we're just happy he was able to provide his tips. So I'm actually, we have another question that we're going to address in a second. Before we do that, I wanted to just give out another poll about how helpful, if you could let us know how helpful you think was today's webinar. So I'm going to launch that poll, and in the Q&A section, if there's anything, future topics that you're interested in, or anything else that you feel like we can do to make these webinars and even our resource emails that we'll send to you more helpful, you can certainly either email me or write it in the Q&A section. So I'll leave that up for a little bit, and then we're gonna also move on to our last two questions of the night as well. And actually, I think I can do it at the same time. So this question is about evidence-based treatments or evidence-based practices. So what kinds of evidence-based practices are folks likely to experience? I don't know, Fab, did you want to start by giving an overview of some of the evidence-based practices that people use?
Yeah, I mean, I can talk about the clinic, I can talk about people in general, and really the reality is that it's important to, I think that's a good question, because some clinics might use more evidence-based treatment than others. In terms of the clinic at the outpatient clinic in Rochester, they do use a lot of CBT, so cognitive behavioral therapy, that has been shown to be effective when working with children with anxiety and depression. There's also different social skill groups that I think we've mentioned about that has been offered that use metallized treatment that are evidence-based. But ultimately, it's strategies that, as Dr. Alpert-Gillis has mentioned, has had some research to show that those are effective in reducing symptoms that are induced by children or them. Yeah, I don't know if you would want to add anything to that, Dr.
Linda, did you want to talk about specifically about the evidence-based treatments we offer in our clinic?
Yeah, so we provide a lot of CBT, cognitive behavioral therapy, also DBT, dialectical behavioral therapy, IPT, interpersonal psychotherapy for teens with depression. Also, we see a lot of kids that have experienced trauma and provide trauma-focused CBT, or TF CBT as it's called. And parent behavioral training, where we work with parents on disruptive behaviors that kids may experience. Also providing kids with skills on managing other kinds of behaviors that go along with attention deficit disorders. Skills or groups like the peers group, which Fab was very involved in and ran for many years for adolescent children on the autism spectrum, which is developed out of UCLA, an evidence-based program. So we really acceptance and commitment therapy. So we provide lots of different ones. We're not kind of, everybody gets the same thing. So one of the things that we've tried to create is hiring clinicians with different skills that can meet the varied demands of the populations that we serve. And so it's really that matching up of kids' needs with therapists is so important for that reason, in our opinion.
Great, thank you. We had another question come up about during this time of COVID. Do you notice if there's been an increase in children and teen mental health needs? I see Fab is really.
Yeah, absolutely. I think that especially for teenagers where social interactions is so key for not only with their development, but it's an important aspect of their life. So they don't get to interact with their peers the same way. So I have noticed a big increase in anxiety concerns, depressive concerns, and it's just hard for a lot of teens and children to engage in activity that they usually enjoy and look forward to, because there's just not the same access to those activities anymore. So I think it's just very important for families to be maybe sometimes creative and in terms of finding different activities that are safe, but also mindful of spending time with their children so that they can monitor how they're doing through this hard time.
Yeah, I would say also we've seen some kids do better because they don't have the stresses that normally come along with going to school and being in that social environment. So I think it has varied, but definitely I think society right now is very stressed and kids are not immune to that. And we're not immune to it. So I think one of the interesting things about the pandemic is really encouraging clinicians to take care of themselves, because we are experiencing a lot of the stressors right along with the families that we serve. And so we need to be very mindful, just like parents and everybody needs to be mindful of managing their own stress and doing what we need to do to feel good.
Great. And speaking of therapy during times of COVID, lots of people are doing teletherapy. So I'm wondering, Bree, if you can sort of let us know about, do you have any tips for people who are about to engage in therapy, something that they can do to make it more successful? And how are teens and kids doing with teletherapy?
Absolutely. I think we've had such a great response with our telehealth therapy because kids are used to it with school at this point. So some of the tips that we like to give parents when engaging with therapy over Zoom is make sure that your kiddo is taking screen breaks whenever they can. We understand that schooling is really important, as is therapy, and it's also incredibly important to make sure that we break up some of that screen time. So if that means changing up the typical appointment times, and that's something that we're going to want to do. Having a safe, quiet place for your kiddo to engage in therapy is also incredibly important. When we're in person, we have offices that we take kids back to that you cannot hear anything out of. And so it's really important for all of our kids to still feel like they have that confidentiality. And for parents, this is a great time to engage with your child's therapist and in therapy in general. The nice part about televisits is that you can log on from work. If you want to jump in on a session and give an update on how your kiddo is doing, parents get the Zoom links. So it's gone incredibly well for us. I have a lot of families who don't want to go back to in-person therapy. So we'll see how it goes.
Thank you. Fab, did you have anything to add?
No, I think again, I think it's been going well. Even doing assessment and starting treatment, I think it's been. I'm a big fan of in-person interaction, so I had some hesitation at the idea of starting, that therapeutic process during Zoom, but it actually has been going very well, and it's actually surprising to see how the teens and children feel connected with us without even meeting us in person, and we feel the same way, or I feel the same way. But so far, I think that the flexibility that it provides actually outweighs some of the barriers that we have. So I've done therapy with, as mentioned, Dr. Alpert-Gillis mentioned, like anywhere, like campsite cars, family trips. But it's great because family can continue to work on their skills wherever they go. So
That's great. Thank you so much for your updates and for your participation. I'm going to start summarizing all of your wonderful tips. We really appreciated our panelists tonight, and we appreciated everyone who submitted questions and been actively engaged in learning more about therapy and assessment services for your kids. So the main takeaways from today's conversation are that there are many different kinds of services available for children and adolescents who are experiencing mental health concerns. And you're not alone in deciding about therapy or assessment services. There are many different kinds of supports in our community to talk to before making the decision to initiate services. And when you do initiate services, you are welcome to collaborate. And in fact, it's highly recommended to collaborate with your mental health provider, giving them frequent feedback on how things are going and how you think that therapy is going. And they should be open to hearing your feedback for sure. We will be sending out an email with resources related to all the resources that Dr. Alpert-Gillis had mentioned in her PowerPoint presentation, and additional resources as well. They will be available in Spanish as well. And thank you very much to the Greater Rochester Health Foundation and the Department of Psychiatry. We have our next community conversation coming up on December 3rd at noon, and that one will be about how to think about medication for behavioral health concerns. So thank you very much, and please, you're welcome to provide us feedback at any time. Have a good night. Thank you for attending.